When my mom went into long-term care, as for everyone, we didn't know we were giving up their rights.
Jeanette Harper's mother didn't need a wheelchair when the pandemic began. She believes Marguerite Bell might still be walking if she'd been allowed regular visitors and engagement for the last 2 years.
She was just a vacant shell, and you saw your loved one just slipping away from you through a window.
Harper says she's pleased to see this draft set of national standards for long-term care focused on resident well-being with 181 criteria. One of the focuses, respecting a resident's right to live with risk, a flashpoint in the pandemic where prolonged isolation and visitor restrictions have had devastating consequences.
Families are just saying, look, we don't want to do this. We'd rather just get COVID. My mental health cannot take another period of lockdown.
I would have liked to have seen very clear language on you are not allowed to separate family again, period.
This long-term care advocate wanted more specifics, including a minimum number of hours of care per resident per day.
I was hoping to see clear standards that are actually enforceable.
Implementation is another matter. Ottawa committed $3 billion in the last budget to improve long-term care, but wouldn't say Thursday if it will commit to legislating these national standards. The Health and Seniors Minister saying they will respect provincial jurisdiction.
They are, in a way, suggestions, unless the government takes the needed steps to both fund the changes that these standards require, make staff available.
My God, I'm hoping that this will be a clear blueprint that really can enable provincial and territorial and federal action to move long-term care to where all Canadians are demanding it to go.
These draft standards focus on care. There's a second set in the works from another organization which focus on infection control and infrastructure. After public consultation, both groups are expected to present final versions by the end of the year. By then, it will be nearly 3 years since the horrors of the pandemic in long-term care began. Abigail Bimman, Global News, Ottawa.